We will move on now to our next set of presenters, representing the National Coalition of 100 Black Women, the LA chapter, Dr. Linda James and Dr. Carmen Downs. Sometimes we don't know what we don't know. And what we do know is that African American women get cancer and die from cancer at a rate alarmingly higher than any other racial group. This amazing organization took this statement to the community, and they will share with us what they have learned. Thank you very much for being here.
Thank you so very much. First and foremost, I would like to sincerely thank the City of Hope. The Healthy Living Grant has been just an unspeakable benefit and value to the organization. For some of you that may have never heard of the National Coalition of 100 Black Women, we are an advocacy organization, not a community service organization. And it directly aligns with our mission. But first, our vision is really to see that Black women and girls live in a world where socioeconomic inequity does not exist. Inequity in the areas of education, public policy, and also health and economic empowerment. Our mission is to advocate on behalf of Black women and girls to promote their leadership development and gender equity, again, in the areas of education, public policy, economic empowerment, and most importantly, health. I sincerely, again, want to thank the City of Hope, but I also want to thank our immediate past president, Dr. Linda James, who's not only our immediate past president, but has been such an advocate as our health committee chair in multiple areas and was extremely valuable in securing this grant, but also really illustrating, demonstrating what advocacy means. So I will now turn it over to her. And you're on mute.
Thank you. Hi, I am Dr. Linda James. I am a family practice physician, and I am pleased to be here to talk about the work that we did. Our objectives and our goals for this project was to deploy a breast cancer survey of at least 200 Black women in the greater Los Angeles area and across the country. The number two thing we wanted to do was to utilize results to promote breast cancer risk care awareness, address barriers, and increase policy activities. The third thing we wanted to do was develop educational tools. We felt that there was a gap in the information on our community, and we needed to analyze and provide the African American community's information to the medical and research world. We also wanted to have African American women discuss how disparities in health affect breast cancer morbidity, mortality, and health experiences. Can you go to the next slide, please? Next slide. Next slide. So our program design, the survey was developed to ask questions of predominantly African-American women. The survey has 69 questions to ask about, it was gonna take about 10 minutes on a Survey Monkey. We reviewed 23 abstracts, summarized each abstract or article. We focused on African-American women discussing health disparities in breast cancer morbidity, mortality, and health experiences. The survey was distributed to our social media network, email list, churches, African-American women's groups, such as the cancer survivor groups, sororities, professional groups, our family, and our friends. We wanted the women that we reached to feel comfortable in being part of our research study. We also wanted the information to come from a trusted source. Next slide, please. So this was a flyer that we collaborated with the IT team of the National Coalition, the president, as well as the health committee on what we thought would introduce our survey to the community. Next slide. So the survey creation, again, 69 questions, Survey Monkey, social media blast, press release utilized, We went throughout the greater Los Angeles area as well as the entire country. This included, but not limited to, African-American women. We focused on churches, sororities, Association for African-American Physicians, and other organizations that predominantly African-American women are involved in. We had, at that point, 227 surveys were completed, returned 181 completed, 80% completion rate. The distribution and collection of the responses to the pilot data ran from March 7th to April 8th, 2022. Today, we have 724 surveys completed, and the time frame that we look at this was from April the 9th to June 2nd, 2022. So we're very pleased. The pilot was completed, and now we're just continuing to collect the data, and then we'll review it after a certain time period when we feel like we have enough women enrolled in the survey. Next slide, please. So this slide was one of the questions we had asked. Most women with breast cancer were diagnosed by mammogram, 53%, breast biopsy, 48%, and self-exams were 43%. Next slide, please. At what stage were we diagnosed with breast cancer? From this total number of women surveyed, 17% had breast cancer, 81% were diagnosed early, and 19% were diagnosed late. Next slide. So on this slide, we asked the question, did you feel that your doctor cared about you during your breast cancer? 86% self-identified breast cancer patients felt their doctor cared about them during their breast cancer journey. Next slide. When participants were asked the level of risk African-American women had compared to other ethnic groups, 79% of the participants answered the question saying that African-American women have a higher risk of breast cancer. Next slide. For this slide, we asked the question of, do you think African-Americans get the same standard of care that other ethnic groups receive? 86% answered no. 11% thought that there was the same treatment. Next slide. Next slide. Thank you. So for this one, we looked at what are some methods that have increased your awareness about breast cancer? The top 4 answers were the doctor's office, 20%, family and friends, 17%, social media, 10%, and health fairs, 10%. So this one we thought was very interesting to see how are people getting their information and what was helpful. The next thing we looked at was, would you like to see more research done into breast cancer treatment, focusing on African-American women? And the people that did the survey, most people thought, yes, we should take a look at. Oh, next slide, please. So I'm sorry, this slide is talking about should we do more research? And most people, of course, thought, yes, we should. And that was about 86% of the people that answered, well, 141 people answered the question. The next slide. This was a very important question we felt. Would you participate in a research clinical trial for breast cancer? This question was important because of the current belief that African-American women will not participate in research studies. Many of the women stated they were not sure, but another half thought that they would participate. So a little bit, almost half the women that were asked thought that they would participate in research. Only 17 of the women asked at that point in time said no, outright, that they would not. So it was very encouraging that some people were on the fence about it, and most people who answered the question said yes, they would go ahead and be a part of a survey. So that was very encouraging to see because it is needed. Next slide, please. So we wanted to know, did we meet our objectives? We wanted to reach 200 people. At that time, we reached 229. We have currently reached 724 African-American women. We created a strategic plan. the strategic plan was to create advocacy letters, article. So we're now in the process of sending off our advocacy letters and doing a submission for our article to be published, so we can get out the word more to the scientific and medical community. We developed 3 educational tools that corresponded to the survey findings and breast cancer disparities. We did fact sheet on breast cancer disparities. We have a program called NCBW LA Health Talk that we put on social media, on YouTube, and our Facebook page. The last thing we wanted to look at was how to share this information. So we are in the process of presenting this information to our national as well as our local LA chapter. Next slide, please. So in summary, the NCB set out to learn more about breast cancer disparities in the African-American population, specifically in the Greater Los Angeles area, but was not limited. It was across the country. The survey was created to target information, including but not limited to breast cancer awareness, knowledge, advocacy. The results will be utilized to increase awareness of breast cancer risk in African-American women, reduce barriers in seeking breast cancer care for African-American women, and lastly, to increase local and national level policy activities that address health inequities for African-American women seeking breast cancer care and support. Next slide. So reflection. We want to identify how to move our advocacy efforts forward, acknowledge where our team needed more expertise in the field of research, utilize our partners such as City of Hope. The 229 women in the survey would be used for our pilot group program. On May 21st, 2022, we participated at the KJLH Long Beach Health Expo, where we presented our survey to the community, and we got several more people interested in completing the survey and knowing why we're doing it. We use QR code to the SurveyMonkey link, and we discussed the breast cancer initiative with the community. We're going to also continue doing this by incorporating this in our other events, such as the October Health Summit for the 5th. We're going to present more information to the community that way. Our advocacy request. We would like to see a 5-year research project done that incorporates our recommendations to improve morbidity and mortality. We want to possibly see MRIs done for women with dense breast at the age of 35. We recommend a screening test developed for breast cancer, specifically women with dense breast tissue and women with triple negative breast cancer types. We suggest a long-term research study on the target population and health disparities. Next slide, please. So what did we learn unexpectedly? The results we got more than the 200. We were very pleased about that. Our completion rate of a survey, which we were not sure if people were going to want to do surveys, was very good. People were very excited about completing the survey, and we're excited to see how many more people we can get. So the African-American woman stated that, so I think I wanted to summarize. So the biggest things that we learned was that many of the participants did not know that African-American women have dense breast, triple negative breast cancer. Young women are diagnosed late, and they have more aggressive cancer when they are diagnosed. This allowed the breast cancer survivors. We also talked to breast survivors, and they felt like they had a voice with the survey. So that was pleasing to hear. We didn't realize that how much a research project takes to do. Next slide. Moving forward, we want to send out our advocacy letters. We want people to know that African-American women have dense breast, more aggressive breast cancer, younger age of diagnosis, and triple negative breast cancer. We need to have research, screening, diagnostic studies needed to look at dense breast tissue and triple-negative breast cancer. Next slide, please. So we want to call everyone to action to contact your senators and House of Representatives to let them know that we need to have more research to support breast cancer in triple-negative and gene types. I will skip to the next slide. And I'd like to say thank you to the City of Hope, to Ashley Acevedo for her help with the research, as well as Albert James, who helped do the research analyst. And thank you to my president for the support in this research project and all the people that gave us support that I have not named because I'm nervous. Thank you.
And I'd like to also just reiterate our thank you to City of Hope. And again, Dr. James for her passion, her significant passion on this topic. And really, most importantly, all of the individuals behind the scenes within the National Coalition of 100 Black Women Health Committee. Too many here to list, but a significant amount of gratitude goes to them as well.
And then I wanted to mention Nancy Hawkins. Thank you so very much for all of your support. Thank you.